研究科教授中村康秀先生、よろしくお願いいたします。
それでは第2部を始めさせていただきたいと思います。第2部ですけれども、第2部のテーマといたしまして、日本の医療通訳教育の歩むべき方向性というテーマで進めていきたいと思います。それでは、まず最初の講演に移らせていただきたいと思いますが、イザベル先生のご紹介の方、中村先生の方からよろしくお願いいたします。
第2部の座長を南谷先生と一緒にさせていただきます大阪大学の人間科学研究科の中村康秀です。今日はよろしくお願いします。早速ですけれども、イザベル・アローチャさんの、今日の、メインイベントの、講演、メディカルインタープリターエデュケーションについて、の前に、イザベル・アローチャ先生の、ご略歴を簡単に紹介させていただきます。イザベルさんはインターナショナルメディカルインタープリターズアソシエーションの会長でいらっしゃいます。そしてまた彼女自身は英語とスペイン語の通訳、そしてまたカルチャール・リンゲージリンギスティック・エデュケーターとしてボストンのケンブリッジヘルスアライアンス、ケンブリッジの、医療連盟というところで働いています。ここでは実際に3つのコミュニティの病院と25のヘルスセンターを抱えているような医療機関で実際にそういう仕事もなさっています。そしてまた長い間にわたってイザベルさんはこの外国人の、患者に関することで、アドボカシーあるいは技術的なことそしてまたそういう、学会をの運営、いろんなことに関わってこられました。そして、そのような学際的なそして活動をですね、アメリカだけではなくってベルギーとかオーストラリアとかカナダとかいろんなところで全米はもとより各国で発表されてきました。そして今日日本でこのイザベル・アローチャさんの今までのご経験とそしてまたメディカルインタープリターのエデュケーションの重要性について今日はお話を聞けるのをとても嬉しく思っています。でイザベルさんは昨夜、大阪に、疲れてそしてちょうど今このような時期で今回はすごい日本の桜を見るのをとても楽しみにしてらっしゃるということです。それではイザベルさんよろしくお願いします。イザベル、so please, thank you very much for your coming, and so please start.
Thank you very much. Thank you very much. It's a great pleasure to be here. I absolutely love your country. I love Japan. I lived here when I was very young, and I remember the sakura every year, and I'm very looking forward to it. I want to ask here out of my audience, how many of you are medical interpreters? If you could raise your hand. Okay, I see quite a few of you. And I have to say that I really admire the work that you do every day with patients. I'm a continuous promoter of the work that medical interpreters do because it's very important. It's very important work, and there's much for us to teach about our work. So the title of this presentation is Interpreter Education, the Foundation of a Profession. And I know that in Japan there are medical interpreting educational programs already. And interpreting is not a new profession, but it is evolving. It's an evolving field. And the big message of this lecture would be that it's important for us to value the education, because that is what's going to give us recognition for our work, great working conditions, and more than anything, a real strong foundation for a strong profession for the future. So let me get started. Just to give you an idea of what I'll be talking about, I'm just going to talk a little bit about some of the history of how interpreting programs have come to play. The difference between training and education, the question of educational standards for medical interpreters, and just, what's going on in different countries relating to medical interpreter education. A couple of lessons learned and some conclusions. And there are always going to be new lessons to learn, but I'm giving you a few. So in terms of the history of interpreter education, certainly medical interpreter education is a sub-discipline of adult education, of applied linguistics, or many translation studies are now opening interpreting programs, and also health occupation training centers. We've seen in some countries programs that have different health occupations deciding to start medical interpreting programs. Now, the interpreter education that actually specializes in medical interpreting started in the 80s. While interpreting programs have been in place for many decades, there wasn't specific training before the 80s on medical interpreting. And this education can occur in many different settings. For example, we see many professional development workshops. These are workshops that touch on a topic, whether it's medical or interpreter related. Also practicum formats or internships at hospitals. Some interpreters were trained in hospitals. For-profit training companies that are hiring interpreters and providing interpreters and need to train them to better meet the needs of their clients. Health adjunct professions, also called allied professions, also have training programs. These would be, for example, medical assistants or technologists in the medical area that these programs decide to open a course on medical interpreting. And then formal college or university programs. Usually they have language departments or translation departments, and then they decide to develop an interpretation department. So interpreter education can happen in many places. Now, we tend to use the word training and education actually without much thought, but there are differences. And when I talk about, I'm glad I took this off because